This morning we are discussing Women's Health Month with two highly respected and experienced veterans in the field of women's medicine. One is a gynecologist and obstetrician, and the other is a urogynecologist. So I want to welcome to the show Dr. Jarita Francis Phillips and Dr. Laurephile Desrosiers. Welcome to Bahamas at Sunrise.
Good morning.
Good morning.
Good morning. So we hear all the time about the importance of annual visits and regular checkups. Dr. Francis Phillips, can you speak to and elaborate on why that's important in the area of women's health?
So certainly, for women, it's basically important to have at least an annual well women's visit. It gives the patient basically a time for her to build a rapport with her physician. It gives the physician a time basically to understand and get to know the patient, identifying basically any risk factors that that patient may have that may promote certain health concerns. It's also a good time for basically primary prevention, so where we can basically consult and establish some screening techniques so that we can basically avoid certain diseases in the future.
Okay. And what would you say are some of the most common complaints or concerns that women raise with you when they come into your office?
Right, so I think that question basically depends on the patient's age. So the younger patients sometimes may be more concerned about contraception, and so contraception counseling is more important for them. As the women tend to mature, the concerns tend to be about family planning and basically pregnancy or the ability to conceive. And then further concerns for our seasoned women sometimes tend to be menstrual irregularities like heavy menstrual bleeding, secondary to uterine fibroids as such. Also chronic pelvic pain with conditions like endometriosis.
Okay, understood. So, Dr. Desrosiers, can you talk a little bit about what urogynecology is and how that differs, what you do, how does that differ from, say, an obstetrician and gynecologist like Dr. Francis Phillips?
Yeah, that's a great question. So urogynecology first was called FPMRS, so Female Pelvic Medicine and Reconstructive Surgery. Long words, mouthful. People were like, wait, what? And so we said, let's just go ahead and cut it to urogynecology. And so there are two pathways rather. You can go through OBGYN residency and then do which is typically a 4-year residency and then an additional 3 years of training. Or you can do a urology residency, which is 5 years training with 2 additional years of training in urogyn. And you'll be classified as either a female urologist or a urogynecologist.
Okay. Now, I know you've mentioned and you talk a lot about urinary incontinence when it comes to your area of specialty. But what are some warning signs that women should be aware of to say, I may have an issue in that particular way?
Urinary incontinence, I emphasize it because it is a disease process that affects a lot of women. It's a silent disease that that goes ignored for the most part, and we've sort of conditioned ourselves and sometimes our patients to think that that's a normal part of aging. And I want to dismiss that myth. It is not normal, and we have options. So things that you'll see: urinary urgency. I'm going to the restroom more often. Typically, less than 8 times in 24 hours is normal. If you're going more than that, then that's abnormal. Urgency is the sense of not being able to defer the urge to go to the restroom. So if that's happening, where you literally are trying to get your undergarments off and you feel like the urine's coming out, that's abnormal. In addition, nighttime urination is something that we really haven't talked much about, but that typically is a sign that there's something that's going on. Or having urinary hesitancy. You feel the urge, you get there, and all of a sudden you feel like you can't urinate. Right. All of these things are signs that there's something that's going on that needs to be evaluated.
Okay. So going back to you, Dr. Francis Phillips, you mentioned endometriosis in our earlier discussion. What are some of the warning signs that women should be aware of when it comes to endometriosis?
Okay, so patients with endometriosis can typically present with a variety of symptoms, but the more common ones would include pain during the menstruation. So painful cycles that may actually start a day or 2 before the onset of menstruation and may last typically into the duration or the first few days of the menstrual cycle. Those are one of the common presentations. We call that dysmenorrhea. Also, patients with endometriosis may have pain full intercourse, so having intercourse may be difficult, or they may just have all-around pain in the pelvic area. We call that chronic pelvic pain. Some patients with endometriosis may actually present for the very first time with concerns about infertility. Patients may also have symptoms that may mimic other conditions. We may have symptoms that mimic gastrointestinal conditions such as diarrhea, nausea, constipation, or even painful defecation. They may have symptoms mimicking urinary tract conditions, so painful urination, one of them. They may have simple problems like back pain as well. So the symptoms can vary, but the first 3 symptoms are usually the most common ones, which is basically the pain during the menstruation, pain, chronic pelvic pain, and or pain during intercourse.
Right. So as we have this conversation, it becomes kind of obvious that there's a give and take when it comes to Urogyn and OBGYN. So Dr. Frances Phillips, can you kind of talk a little bit about how those 2 areas of specialty intersect?
Right, so basically I like to consider the urogynecologist as an older sister to a gynecologist. So basically the younger sister, the gynecologist, would start to see some patients that may present with common female conditions or pelvic floor disorders, be it incontinence, be it a prolapse. And so sometimes we may be able to manage these patients ourselves using some conservative measures. And after a period of managing these patients conservatively, if for a reason the condition is worsening or not improving, that we may need to seek additional resources via the urogynecologist.
Okay. And that makes sense. So, Dr. Desrosiers, how would you say urogynecology addresses those sorts of disorders? So, pelvic floor issues, prolapse, urinary incontinence. Where does Urogyn fit in as a treatment mechanism for those issues?
Yeah, great question. So I feel like our job is to be a support system for the gynecologists and obstetricians who are seeing these patients on the front line. And so it's not that we want them to send us every patient, because I don't think that that's practical, but I think that starting the management with conservative management, and then being there for collaboration. Plenty of times my colleagues will say, hey, listen, I'm seeing somebody, what do you think about X, Y, and Z? They don't need to send me the patient, they're already seeing the patient, but I'm happy to sort of give them consultation over the phone and just discuss with them what may be helpful. So where we can sort of be helpful is giving options in terms of additional diagnostics and different ways to evaluate the patients. There are times when we need to do a CT urogram, for example, and all of those can be, that may not be within their purview, so I can sort of guide through that. And there are times when we need to collaborate together surgically. I do a lot of minimally invasive procedures, which is something that's very important. I think that we need to provide more minimally invasive procedures to the patients on the island, and so I feel like that's where I sort of can come and be of help.
Right, and that makes sense. And it seems like it's just a natural, like I said, a natural hand come hand go in terms of the interaction between the two, and it works in a multidisciplinary space, which I think medicine is continuing to move further and further in that way as people are dealing with more complex issues. So that's good to hear. My final question for both of you: why must women take care of their health? So I'll start with you, Dr. Desrosiers, and then we'll end with Dr. Frances Phillips.
That is a great question. So we are the backbone, not just here, everywhere. Women are the ones that take care of everyone else. They take care of their partners, the children, their parents, et cetera, et cetera. And oftentimes we get neglected. And it's not because we're doing it on purpose, it's because we want to make sure that we're taking care of everyone else. But we, again, are the backbone. And so if the backbone goes out, then the whole piece will fall apart. So it's very important that we're listening to our bodies, listening and not just saying, I'll take care of it later on, or that's just a part of aging. Right. It's important that we seek the care. If you're having urinary urgency, if there's blood in the urine, if there's things that look abnormal, if you're having chronic pain, or if things are getting worse, you need to seek care, because remember, you are the backbone.
Yeah, I'd like to piggyback on what Dr. Desrosiers mentioned. We do everything in the homes. We're no longer stay-at-home wives. Most of us, we are working, we're career-oriented. And so it becomes sometimes a challenge for women to wear all the different hats. But it is important to take time out for yourself. You may be preventing a whole lot of complications later on. So I advise women to just take a moment, whether it be your birthday month, and that may be a good way to celebrate your birthday by celebrating you. So self-care is important. Just as how we may sometimes take care of ourselves, we do our hairdressing, our nails, it's very important for us to also plug in that time for our well women's visits and our visits to our gynecologist.
Yeah, basically, you're saying to keep the same energy when it comes to your health.
Oh, yes,
Yeah,
definitely.
Understood. Dr. Desrosiers, Dr. Francis Phillips, I want to thank you both for joining us on Bahamas at Sunrise this morning.
Thank you for having us.
All right, we'll be right back.